Assalamu alaikum and very good evening. I'm Professor Nazma Haque, head of the department OBGYN and Gyne Oncology Unit, Dhaka Medical College and Hospital. Most welcome everyone. Today we come here to say something about the cervical cancer. Cervical cancer is such a disease. It's the cancer only female cancer. It can be prevented and there is a nice vaccine which can prevent the cervical cancer for lifelong. What is cervical cancer? Yes, cervix is the part of the uterus which project into the vagina, and the cervix is the important part for the procreation of a female organ, but it's a vulnerable part for prone to cervical cancer. And the mucosal lining of the cervix is the part which imposes to various organisms in the vagina. It is the nomenclature of vagina, but it may harmful to procreate the cervical cancer. And that is the 70% of the cause of cervical cancer is a virus. Everybody we know that is the human papilloma virus. Normally, it cannot do any harm, but in some risk factor, it causes harmful and it invites cervical cancer. So HPV virus is the culprit for the cervical cancer. But when a woman or a girl are in risk, we can discuss today in short the risk factor for a girl or a woman are main cause is the abnormal sexual behavior, which are the early age marriage, multiparity, again the multiple sexual partner, or woman is the one but the partner has multiple sexual partner. Again, the early age pregnancy, it causes repeated pregnancy. There is a trauma of the cervix and which causes cervical cancer by the human papilloma virus. And other cause also, if the girl or woman is immunosuppressive stage, such as organ transplant or any other causes on steroid, it is a risk factor for her. Now we can start. These are the causes of cervical risk factor, cancer risk factor. And if we can avoid this, usually we can prevent the cervical cancer. Earliest to avoid the earliest marriage and the abnormal sexual behavior like the avoid multiple sexual partner, avoid is a STD, that is sexually transmitted disease, if occur then treated timely, and also smoking or patient who are immunosuppressive, take care to the woman. And how we can prevent it? There is a 3-layer of prevention for cervical cancer. In case of primary prevention, it needs increase the awareness about the cervical cancer, which causes the risk factor of cervical cancer for a woman or girl. And at a time, vaccination is very much important. And secondary prevention can be done by screening procedure. Cervical cancer screening procedure is worldwide established procedure. In case of developed country, it can be screened HPV DNA test. But in our country, like our developing or underdeveloped country, VIA is a procedure which is without any cost, very much low setting source. It can be done by the VIA or pap smear where the cytology procedure is available. So VIA or PAPs, it can be used in grassroots level. If anyone is positive, then that woman or girl are referred to colposcopy clinic and do the colposcopy. Or colposcopy also indicated when VIA or PAPs are both are negative, but patient are in suspicious case like postcoital bleeding or any contact bleeding from the cervix. When the colposcopy done, then second step, if colposcopy see any abnormality, then biopsy can be taken under colposcopy guided, and the biopsy tissue, after histopathology report from the biopsy tissue, it confirm whether the cervical epithelium is good or any abnormality. If there abnormality, that can be treated at a colposcopy clinic setting. It's a OPD procedure, and it can be done either in case of CIN1, which is the precancerous lesion. It can be treated by coagulation procedure, or it can, if 2 or 3, then it can be treated by lip or excision procedure, which is usually used in our country also. So about the screening, cervical cancer screening procedure, it is a schedule. When a woman starts the screening procedure, yes, according to World Health Organization, it started at the age of 30 years among the married women, and it should be done 5 yearly up to the 65 years. Even they are negative, please maintain the screening procedure. And what are the screening procedure? It's a simple procedure, no cutting, no injury, only the pervaginal examination. We can done it in our country in low resource area, that is via or pap smear. If any positive, then they are referred to the colposcopy clinic, where they are sure among them who are colposcopically positive, that is diagnosed as a cervical intraepithelial neoplasia. It is the 3 stage, that is CIN1, 2 or 3, and that can be treated. They are treated in that setting according to CIN staging. It's the procedure, we maintain it as a see and treat method. We can save our mother's or woman's life through the screening procedure. We can prevent it, and such in this way we can end our cervical cancer in our country and as a part of the global area. If during screening, if any frank cancer, cervical cancer is diagnosed, then it can be treated as early as possible. That is the tertiary level of prevention. So again, we can go to the primary prevention stage, that is the vaccination. Yes, vaccination is the primary role to prevent the cervical cancer. And vaccination, there is a schedule for the girl or woman. If a girl of 9 to 14 years, then she needs 2 doses only. That is the first time when she gives the vaccine, and then after 6 months. If the girl take the vaccine after 15 years, then 15 to 25 years, this group of vaccine can be treated by 3 doses. That is 0 after 1 month, then after 6 months. That is complete the vaccination dose. Actually, it is the awareness month, so we try to prevent the cervical cancer through our discussion and through our interaction with the people, with the community, with the national wise. Okay, the vaccination can be given also. It can be consideration group up to 45 years, but we try to give it by 14 years or at least by 25 years. And 3 dose vaccine is enough to prevent the cervical cancer. And it is the policy from, it is adjusted with the World Health Organization schedule. Is the policy to eliminate or to end the cervical cancer by 90, 70, 90 theory. What is 90? First 90, that is the vaccination coverage 90% of the girl or woman, and 70% it should be screened among the women at least 2 times at the 45 years and at 55 years, at least 2 times. Other second, 90% cancer diagnosed during screening procedure, then it should be treated as early as possible. Even at the advanced stage of cervical cancer, it can be treated by palliative treatment. So we can save our girl to women's life worldwide. Yes, why it is important? It should be kept in mind. Worldwide, we see there is about 6 lakh women diagnosed new cases yearly, and among them more than 3 lakh women died from the cervical cancer. And in our country, that is in Bangladesh, statistics show that is every year new cases about 17,500 people diagnosed as a cervical new cases, and among them 10,000, more than 10,000 people died due to cervical cancer. So it's a very sensitive issue for in our country as well as worldwide. Be careful. Please join our hand with all the women, all the gynecologists, and we can save our mother's life from cervical cancer. Inshallah. Thank you very much.